What are you going to pay monthly for Medicare Part B? Medicare Part B is your doctor's coverage, your outpatient coverage, labs, tests, etc. Now, some of you may be saying, well, wait, I don't have to pay for Medicare Part B. I've been paying a FICA tax all these years. But remember, the FICA tax that you saw coming out of your paycheck goes towards Medicare Part A, your hospital coverage. So let's look at Medicare Part B in 2024. Most people are going to pay $174.70 for Medicare Part B. That is a monthly premium in 2024. But some of you, if you are a higher income earner, are going to have something called IRMA. It's an increase in the monthly premium that you have to pay if you are earning above a certain threshold. What the Social Security Administration does is they look at your modified adjusted gross income to determine if you're going to fall into one of the higher categories. And they're going to look at income that was reported 2 years prior. So if you take a look at this chart, if you file single or if you file married jointly, you're going to have different thresholds. So anybody making $103,000 or less single or $206,000 or less joint are going to pay the standard amount. If you look behind me, if you fall in any of these categories, you are going to pay an increased payment on your Medicare Part B. We can look at an example. If you're single and you're earning between $161,000 and $193,000, you're going to pay that amount for your monthly Part B premium. Now, your reaction may be, wait a minute, it's on income reported 2 years prior, but what if I'm retiring? Or if I'm going to work less? There is something called an IRMA appeal that you can do. There are 7 or 8 grounds as a basis for an appeal. So if you find yourself in that position and your income has been reduced substantially from the 2 years prior how it was reported, you will have that opportunity to try to appeal it. But just remember, when you're looking at what your costs are in retirement, don't forget about IRMA. And when you're assessing should you go from your group plan to Medicare, IRMA is a factor you need to think about as well when you're looking at costs.